Jane, let me mention the idea you touched on, prevention. We're spending $5 trillion as a country, that's the number I get, $2 trillion on Medicare and Medicaid. Seems like we're getting sicker at large, and we're spending a lot more money. It seems like everything's reactive. Instead, you get the heart disease, you get the obesity, that, then you try to deal with it. But it just seems like it's so much more expensive. Can you expand a little bit more on your idea of prevention? Because it seems like the business that all of you are in, the more you make, if you keep the folks healthy. And we're reacting once it happens. As a guy, I'll just say one other thing. As someone that's been in business a long time, one of the most important things is to get the incentives and the pay plan right. And part of the problem, our whole system, to me, is broken. We keep spending more and getting less for whatever reason. And I just like to see us, someone said you got to be the CEO of your own health. We've got to have people take a little more responsibility, or encourage them or help educate them to take more responsibility for their own health. But there's so much misinformation out there, it's not anybody's fault. But when you have 50 to 60% of the people in the country is obese, they say 30% for young men, young ladies trying to go in the military, obese. They're talking about children at 20% or 18% obese, and that wasn't the way we grew up. So my point is, I'm interested in your thought initially. You know, where are we at on this? Because I don't, if we don't change that paradigm, I don't see how we get ever where we're going. We'll never have enough money. $5 trillion we're spending now. How much more we got to spend for what we're getting?
Well, thank you so much for the question. You know, I think about this question really in very personal terms. My father was diagnosed with diabetes in 1985. The first time that a physician, or a medical student in this case, the medical student was me, referred him to a dietitian was in the year 2006. And the reality is that we have a medical system right now that treats people when they become sick, but does very little to actually prevent them from becoming sick in the first place.
Bullseye.
We will pay for expensive procedures on people's retinas, we'll pay for their dialysis, we'll pay for their cardiovascular interventions. But had we actually intervened on my father, who passed a couple of years ago, in the 80s and 90s with lifestyle interventions, with a more intensive focus on actually counseling him on his disease, for pennies on the dollar, he might still be here today. That's the kind of thing that we try to do at SCAN for our Medicare beneficiaries. We try to think about their chronic diseases, intervene upon them early, get them the kind of supplemental benefits that they need to keep them healthy and well. I think there's incredible opportunities for us to intervene upon people and prevent things. 65, however, is too late. When I meet our Medicare beneficiaries, they've had 65 years in a fee-for-service system where they've largely been disconnected from primary care, or if they have primary care, we're focusing on treating their problems when they actually arise, as opposed to actually slowing or delaying their progression or preventing them from happening in the first place. I think we have incredible opportunities through the Medicare Advantage program.
Why do you think the whole thing on obesity has become such a big issue, especially when I got 10 grandkids, 10 and under, and I'm very concerned about what they're eating or what they're doing. They don't have any of those issues now, but any kids, I don't like to see what's going on in that space. Dr. Miller, let me ask you, what's your thought on prevention? What more can we do? Is our system backward? We're reacting to the problem. It costs a lot more to react on stage 4 cancer or something than trying to prevent it in the first place. And so that's just the way I look at it, the way I want to run my life is that way. Someone said the first time you have the first heart attack, when you have your first if someone has a first heart attack, half of them never see the next day. So I thought to myself 20 years ago, how do I not prevent that to begin with? So I get back to the whole idea of prevention.
So thank you for the question. I think part of this gets around to how we can customize benefits rather than standardize benefits. We have special needs plans or SNP plans. We have I-SNPs for institutionalized beneficiaries who live in skilled nursing facilities. We have D-SNPs for dual eligibles who are eligible for Medicare and Medicaid. And then we have C-SNPs for chronic disease. So I think actually CMS needs to invest some time and energy working to promote this marketplace so we can have customized health benefits to address chronic disease, to address those who are multi-morbid and live in a skilled nursing facility, and also dual eligibles. We could have specialized benefits, specialized marketing and advertising regulations, and then, of course, customized network adequacy. So that way we can get the right patient into the right health benefits package and get the right care.
But is it your thought, should it be, is the system in your mind reactive, or should it be proactive and try to not let people get in the situation in the first place? Some of it's hereditary, I'll take the bet, but there's a high percentage, it's got to be the environment, the food, or something that we're, lack of activity. There's something going on in my mind.
I agree wholeheartedly.